Hello, welcome back. The video topic today is fatty liver. Is it a serious concern? Generally, no. You do not worry that much, but you cannot just leave it. The fatty liver. What is fatty liver? Liver is a huge organ in the abdomen. It's almost ranges between 1.5 kg to 2 kg, and it's well protected below the right ribs. And it has a lot of function, And if the liver cells are replaced by fat cells, it's called fatty liver. And usually we do not worry, but if 10% of the weight of the liver is replaced by fat cells, it's a real serious concern. Okay. Most of the people ask the question, I have a fatty liver, grade 1, do I need to worry, or do I have to do any treatment, all these things? Is it a concern? Because of that, do I get abdomen pain because of that? Usually, fatty livers don't give abdomen pain, and you do not worry initially if it is a grade 1, but you cannot just leave it, and you should take proper precaution to prevent it progressing to the next grades or next level. Okay, what is that? Usually fatty liver is divided into two broad things: alcoholic fatty liver and non-alcoholic fatty liver. And below all these things, the grade 1, 2, 3, 4. What is grade 1? Grade 1 is a simple fatty liver. There is an initial stage where the liver cells are being replaced with the fat cells. It's a grade 1, and you do not worry. And what you need is simple lifestyle change. What is that? First is keep the weight under control, under normal range. So obesity is one of the major reasons for fatty liver. So keep your weight under control. Number 2, keep your hip size. If you are a male, below 90 centimeters, and if you are if you are a female, keep it below 80 centimeters. Central obesity has to be taken. Third, what is that? Treat all if you have a metabolic syndrome, like you have a diabetes, hypertension, cholesterol, thyroid, take care of those diseases and keep them under control. These are the lifestyle changes, and weight reduction is more than enough for the grade 1. And what is grade 2? Grade 2 is an inflammation of the liver cells. It's a stage, where you have to be very careful. Definitely you need to see a doctor, and probably they may do some tests, to look for what could be the reason. The reasons being, like sometimes if you're taking a medicine for cardiac problem, probably that could be a reason for your fatty liver changes, or if your alcohol intake or obesity, all these things they will take it into consideration, and probably they will treat you very vigorously. And grade 3 is nothing but from inflammation, it goes to fibrosis. What is that? Inflammation causes a lot of tissue damages. These tissues heal on its own, producing scar formation. The scar formation leads to fibrosis. That's called grade 3. Definitely it's a very serious condition where it may lead to liver failure, with the cirrhosis. So probably doctors, will treat you aggressively. And what is grade 4? Grade 4 is cirrhosis of the liver. What is that? So the fibrosis causes shrinkage of the liver, which was 2 kg bigger one. Now it becomes a small liver, and that is called permanent liver damage or liver failure. Probably the only treatment available is liver transplant. So fatty liver has a lot of other causes like alcohol, non-alcoholic. In non-alcoholic, age, obesity. Obesity is one of the prime reason. Sleep apnea, cardiac medications, or metabolic syndrome. All these things can give fatty liver. Do we need to worry? Is it a big concern? Definitely no. But you cannot just like that leave it. You should take care to prevent it, to keep it in grade 1 level. That is about fatty liver. Thank you.